Please welcome Dr. Magdalen Campbell.
Firstly, I would like to acknowledge the traditional custodians of the land on which we meet and also pay my respects to elders both past and present. Welcome to the Federal Health Minister, Susan Lee, and our local member, my local member, John Alexander. I'd also like to welcome representatives from the Department of Health, the Northern Sydney Local Health District, our GPs and their general practice teams, my allied health colleagues, members of the board, our clinical councils. We have members of that newly formed clinical council and community council here today, and many of our health partners as well as community members. It is significant that we have the Minister here today. It's a tribute to what we are and what we seek to be, and an acknowledgement of the outstanding work that has been done to get us to this stage by our CEO, Linnell Hales, and our staff at the Northern Sydney PHN. Our experienced staff have served in many roles in the primary health area and enthusiastically come together to fulfil our vision for the future of Northern Sydney. We'd also like to thank Richard Wilcock, our transitional CEO, who paved the way. Thanks, Richard. Now, we all use patient journeys to illustrate the complexity that is our health system. We examine the aspects we got right and where we can do better. Likewise, we can look at the journey of primary health in Australia. Like many of you, when I was young, I had a great GP. He worked very hard on his own, with his wife acting as receptionist and practice manager out the front. She was a real dragon in the moat, defending him from overwork. Now, the cottage industry that was traditional general practice was reshaped in the 1990s by the formation of the divisions of general practice. Divisions worked better to better network GPs, develop the concept of the general practice team with specialist practice managers, embed the role of the practice nurse, and our receptionists were no longer those dragons in the moat, but highly trained for triage and support of our patients. They looked at the systems within the practice, working with the professional bodies, the RACGP, AMA, and the accreditation bodies, and also linked the systems in the wider health network. Projects such as admissions, discharges and death and shared care with the hospitals to enable that passage from the community to the tertiary system to work better in a little way. The divisions worked with general practice and their partners to improve immunisation rates, diabetes care, asthma management, and were integral in the early coordinated care trials for those patients that we're looking at more and more, the chronic and complex care patients. We also started to develop close links with our consumers. We had consumer forums, working parties, and eventually consumers on our boards. It was the beginning of listening to our community. But it was only with general practice that we worked. So eventually along came the Medicare locals, with a much wider remit to look at the coordination of care in the whole primary sector, the private allied health practitioners and community groups. The importance of consumers as partners was still paramount to assist us in the Medicare locals to improve that patient care in our community. Then the dawn of the new age. Like our patient journeys, we learnt from the past, and now we have primary health networks. Our mission, and we did choose to accept it, is to work directly with general practitioners and other primary health care providers, secondary care providers, and hospitals to improve and better coordinate care across the local health system for patients requiring care from multiple providers. Isaac Newton stated, "If I have seen a little further, it is by standing on the shoulders of giants." Northern Sydney's divisions and then the Medicare locals have been at the forefront of innovation, involved with clinical redesign, for example, the GRACE program of care that of elderly patients at Hornsby Hospital, where we worked with the LHD, award-winning shared care programs, our GPs in School program, which of course we've been doing in our region for 20 years now, since 1995. As well as looking at new models of care for people with complex conditions, including mental health in the mental health area. At Northern Sydney PHN, our vision is achieving together better health, better care. and this is reflected in our core activities. Central to it is the person-centred model, the right care in the right place at the right time. Indeed, all our activities aim to improve the health of our community. In particular, Close the Gap. In the Close the Gap, we're going to be working with our Aboriginal and Torres Strait community to improve health care in that area. In primary care, we try to deliver holistic care, but it's always in partnership with our patients. This is enabled through improved IT systems within the practices, communication via secure messaging with other healthcare providers, including secondary and tertiary, the hospitals, and now increasingly allied health. The future for the PHNs includes working closely with these partners. The patient journey, we always hope, is in the community, but realistically we realise it involves care in the hospital setting. The Northern Sydney PHN is strengthening the links that we have already established with the Northern Sydney LHD, but also looking to develop close links with the private hospitals in our region. Our newly appointed clinical and community councils will be working hard to assist us in building primary care capacity and service transformation in our region. I finally just want to again thank Minister Lee for being generous with her time this evening, and welcome everyone for joining us on the continuing journey of primary health in the Northern Sydney region. Thank you.